Hey everybody, so today's video blog is going to be on the topic of thyroid nodules. So what are thyroid nodules? So they're obviously something going on in your thyroid gland. Your thyroid gland sits down in the bottom of your neck. It's an area on each side of your windpipe and then a little bridge across the middle. And that composes your thyroid gland. Now, inside of this gland, in many people, there are little growths that are called nodules. And basically, this is just an area of tissue that's growing inside of the thyroid gland. So most of the time, these nodules are found on x-rays or ultrasounds or various, radiologic studies that were done for another reason. And then they'll be in the comments of that study, oh, so we also see this thyroid nodule or several nodules. So this is what we call an incidental finding, where an x-ray or a scan was done for some other reason, and then the radiologist is seeing something else on it and commenting on that. So that's, I'd say, the most frequent reason that a thyroid nodule is discovered. So at that point, your doctor needs to decide what to do about it, and a lot of times they'll send you to a specialist like me to evaluate the nodule. So what are the nodules? So, again, they're little areas of tissue growth within the thyroid. So you could call it a tumor or a mass. That would be a reasonable term for it. But fortunately, the vast majority of these nodules are not anything serious and not anything to worry about. In fact, in terms of percentages, about 80 to 90% of all thyroid nodules are benign. And by benign, we mean it's not cancer and it's not anything that's going to be harmful. So obviously that leaves about 10 to 20% of nodules that are cancers. But the silver lining with that is that most of those thyroid cancers are a particular type of cancer called papillary thyroid cancer. And papillary cancer is, while it is still a cancer, it's one of the more easily treatable types of cancer, and it has generally a very good long-term prognosis. So if you have been found to have a thyroid nodule, in almost all cases, that nodule is either a benign thing or it's a very treatable type of cancer. So in terms of serious, deadly problems, fortunately, most thyroid nodules are not in that category. So if you are discovered to have a nodule in your thyroid, I'd be happy to see you and evaluate you for that. And in a future video, I'll probably talk about what we do when we discover one of these things. So I hope you guys have a great day, and I hope you learned something, and give us a call if we can help.